Welcome to Brain Explained. In today's video, we will go over what you need to know about schizophrenia. Victoria is a bubbly 27-year-old with a happy personality. In every way, she is a peaceful, easygoing lady, but you wouldn't have known if you had met her in 2019. That was shortly before she was sent to jail for violent acts. Her peace-loving self had become a facade. Her family didn't know what to think, and neither did she. She had never been in trouble before and now prison. While serving term, she was visited by a psychiatrist. Then she was diagnosed with schizophrenia, a mental condition she knew nothing about. Now, whether you have a mental illness or not like Victoria, it is important to learn all you can about this unsuspecting mental condition. Schizophrenia is a chronic, severe mental disorder, one that affects the way a person thinks, acts, expresses emotions, perceives reality, and relates to others. Though schizophrenia isn't as common as other major mental illnesses, it can be the most chronic and disabling. Usually, people with schizophrenia often have problems relating with other people, and it affects their functioning in school, work, and the society at large. They might feel frightened and withdrawn and could appear to have lost touch with reality. Sadly, it is a lifelong disease. Schizophrenia affects approximately 24 million people, or 1 in 300 people worldwide. It occurs in both men and women of all ages, and while men often develop the symptoms in their late teens or early 20s, women tend to show signs in their late 20s and early 30s. Interestingly, there are a lot of misconceptions about this disorder. For example, some people think schizophrenia creates a split personality, while in fact, schizophrenia and split personality, which is also known as dissociative identity disorder, are two different disorders. You may be wondering the causes of this condition. While the exact cause of schizophrenia is unknown, but medical researchers have shown that several factors that are biological, genetic, or environmental can contribute to its occurrence. Interestingly, imaging tests completed on people with schizophrenia often show abnormalities in certain brain structures. Also, people with a family history of schizophrenia have a higher risk of developing this disorder. Exposure to toxins, viruses, or malnutrition before birth or during infancy, living in a highly stressful situation, and taking mind-altering drugs can predispose a person to schizophrenia. Now, whether the causes are known or not, there are ways to successfully diagnose an individual with schizophrenia. How is schizophrenia diagnosed? If symptoms are present, the doctor may take a complete medical history and sometimes a physical exam. While there are no laboratory tests to specifically diagnose schizophrenia, various tests and possibly blood tests or brain imaging studies can be done to rule out another physical illness or intoxication, such as substance-induced psychosis, as the cause of the symptoms. If no other physical reason for the schizophrenia symptoms are found, the person can then be referred to a psychiatrist or psychologist. These professionals use specially designed interviews and assessment tools to evaluate a person for a psychotic disorder. They do this by observing the reports of the symptoms as well as the person's attitude and behavior. After that, he or she is diagnosed with schizophrenia if they have had at least 2 of these symptoms for at least 6 months. Symptoms like delusions, hallucinations, disorganized speech, disorganized or catatonic behavior, and negative symptoms. Let's see what these symptoms look like. Schizophrenic symptoms commonly show up in the teenage years and early 20s. However, at this stage, they often get overlooked because they mirror certain typical adolescent behaviors. These early symptoms include isolation from friends and family, changing friends or social groups, change in focus and concentration, sleep problems, irritability and agitation, difficulties with schoolwork or poor academic performance, anxiety, vague suspiciousness, odd ideas, feeling different from others, and so on. Most times, early symptoms are overlooked and end up becoming more advanced. They become positive symptoms, negative symptoms, and of course, disorganized symptoms. Now, the positive symptoms do not mean good expressions. It only means additional thoughts or actions to a person's typical experience, such as hearing voices or seeing things that are not there. In other words, hallucinations and delusions. It's important to know that positive symptoms aren't seen in individuals without schizophrenia or other types of severe mental illness. In mental health, negative symptoms of schizophrenia are the absence of typical behaviors. They lead to an interruption in a person's emotions, behaviors, and abilities. Negative symptoms can manifest as reduction in speaking, odd emotional responses to situations, a lack of emotion or expressions, loss of interest or excitement for life, social isolation, trouble experiencing pleasure, difficulty beginning or following through with plans, and difficulty completing normal everyday activities. Disorganized symptoms, as the name indicates, show that the person can't think clearly or respond as expected. Generally, symptoms of schizophrenia vary in terms of severity and type and can be worsened when the individual is under stress, uses hard drugs, or is not taking their prescribed medications correctly. Left untreated, it can lead to an increase in the risk of serious complications such as self-injury or suicide, anxiety, phobias, depression, alcohol or drug use, family problems, and so on. Schizophrenia can also make it difficult to work or attend school. Now, if you're unable to work or support yourself financially, there's a higher risk for poverty and homelessness. So it is important to get treatment as soon as possible from a psychiatrist or mental health professional who has experience treating people with this disorder. Mind you, the goal of schizophrenia treatment is to learn how to ease the symptoms and how to cope with them. How is schizophrenia treated? There are treatment options which can be combined to this effect. These include medications, psychotherapy, and social support. For medications, antipsychotic medication is the most common treatment for schizophrenia. It can be used to manage hallucinations and delusions. Another treatment option for schizophrenia is psychosocial intervention. This includes individual therapy to help the patient cope with stress and the illness. Social training can help improve social and communication skills. It is important to know about your local mental health resources available in your community. There may be educational and social support programs beneficial for individuals with schizophrenia, as it can provide a sense of belonging and purpose as they recover. Last but definitely not the least, family support and education. If you or someone you care about has been diagnosed with schizophrenia, having support from family and friends can help lower stress and create a feeling of inclusion. There are educational programs available for family members that can help everyone spot the symptoms and provide support when needed. With proper treatment, most people with schizophrenia can lead productive and fulfilling lives. Depending on how severe the condition is and how well they get and stick with treatment, they should be able to live with their families or in community settings rather than in long-term psychiatric hospitals. Thankfully, research is still ongoing on how the brain works and how brain disorders happen. This will no doubt lead to more effective treatment options and improve the outlook of schizophrenia. If you enjoyed this video, give it a thumbs up and don't forget to subscribe. Thanks for watching.